The second presentation is more specific around the Kahnawake Schools Diabetes Prevention Project. And we've entitled this, Taking the Responsibility to Heal Ourselves. That is the, I think, underlying message of our project back in Kahnawake that we wanted to get across when we started. So this presentation will run you through the project, the components of the project, which is actually a research and training center. And again, as we go along, if there's questions, and also from the satellite campuses, just kind of ask for a question, interrupt me while I'm speaking, because we're not able to see the screen, and we'll stop and make an explanation. Okay, so what we want to look in this workshop is understanding the basics around a community-based participatory research project, the understanding the importance of involving community in planning and decision making, and understanding the value of evolving intervention activities to meet the needs and interests of the community. We're going to have one of those every once in a while in there. I don't know why. I could never get rid of it. Yeah. So not being, also in addition to not being a real quantitative researcher, I'm also not a computer savvy PowerPoint guy. Okay. First, we acknowledge the people that are a part of KSDPP, and I'm the spokesperson in this case here. What we're going to present is the collective work of our staff, our community advisory board members, researchers, students from high school to college through university and postdoctorate who contributed to the efforts, and to our volunteers. And we do this in loving memory of people who were involved around the project and have moved on to the other side in their journeys. Okay. So first, about Kahnawake, as I told you, it's over that way, outside of Montreal, Quebec, about 15 kilometers from downtown Montreal exactly. The other star down here is good old Hamilton. So I say I just paddled my canoe up the river to get here and across the lake, and I made it in record time. Our foods traditionally came from farming, hunting, and fishing as Iroquois people in the beginning of the 20th century. Agriculture and a lot of water type work shifted over to the ironwork industry, and so it's the men from my community who are known as, particularly in the United States, as the builders of skyscrapers and bridges, particularly in New York City and in other cities around North America and in the world. A little bit of bragging rights, not exclusive, but that's what we're known for. We're a very, very militant community and very stubborn. I guess it comes from being Mohawk, being the northeasternmost extreme of the Iroquois communities, almost like an outpost. The first community that met the French when they came in the 1500s and 1600s. And that stubbornness has stayed with, and that fierce independence has stayed with the community right into current times. For more practical purposes of this talk here, the parents control education. Huh? I'm not sure. It looked like a lady had her hand up at one of the campuses. Okay, question? Stretching? Question? Okay. Okay, shout it out though if you do, please. The parents control education since the 1960s in Kahnawake, and we control our own health system since 1970. We have a large community infrastructure, okay, economics, 3 different school systems within the community, police, fire and ambulance, community services, social services, recreation, everything is controlled from within. And there's also a large private sector in the community. Sometimes it seems to make the papers around Canada regarding the import and export of cigarettes and internet technology and casinos. We see that as exerting our rights as independent people. Others choose to call that smuggling or illegal activity.
I want to go back to the shift to ironwork industry. And the reason why our people were doing that high rise is because of their ancestral ways they were so solid, so well grounded or something in their culture and the way they lived and worked, that the higher they went didn't seem to bother them, whereas most people by then lost balance, were worried about being on heights, and they had all kinds of problems health-wise working in the iron industry. I don't know if we can say that about our folks anymore, but in the early times, that's why they did that, because they were so balanced in their bodies that they could go any height and it wouldn't bother them.
Yeah, exactly. And that was the story of when they were building the Victoria Bridge in Montreal, is how people from Kahnawake actually got involved in it. They were rafting the stone down for the piers and all. And when the men were down there, next thing they were just climbing all over everything, all over the place, and just and they put them to work. Yeah, okay. And we also have a community-owned hospital, 43-bed inpatient and a day clinic, diabetes nurse in there. So that's our background about that. In 1985, Dr. Louis T. Montour, fresh out of McGill University Faculty of Medicine, doing his placement at Catawba Memorial Hospital, did a chart review as his project to look at the prevalence of diabetes, because he saw the high rates of diabetes with people coming in for heart attack and repeat heart attacks. And as a result of that, identified 12% of the adults of the community having diabetes. When that was reported back to the community, the elders said to the doctors, well, you have to do something. Please do something to prevent diabetes from hitting the young people. We have the disease. We're stuck with the disease. We have to make do with that. But do something so that the children don't get that. And that becomes a recurring message that we've heard from elders across North America at different conferences in the last 15 years. Where in one case in the Southwest, the nurses reported when they had gone to interview people about their knowledge and understanding of diabetes in I don't remember if it was a Hopi or Navajo Pueblo community, I think it was, where the elders said, don't come into our homes and ask us to talk about diabetes. If you're going to come into our homes and do that, you're inviting the disease in. Come and ask us what we want. Come and ask us what we want. You know? Well, it sounds like you're saying the same thing. It's not. It's a shift in consciousness. It's a shift in consciousness. And the same thing happened in Kahnawake, where the elders were saying to the doctors, do something to prevent the disease from happening. And this emulates 7 generations thinking, or the word that we say, the face is yet to come, the face is yet to come, those unborn, the grandchildren of your grandchildren. We believe the things that we say and do today will impact on them down the road. And so true about diabetes. It's taken 7 generations for it to get here. So between 1994 and 1997, we were a 3-year funded research project looking to prevent diabetes in elementary school children, with, combined with school intervention through a health curriculum and activities in the school and in the community. And then the children being evaluated both through BMIs, as well as life inventories being taken, 7-day food recall, 7-day activity recall, and also a 24-hour dietary recall in a small cohort group within there. These students were followed. The general population was followed in the first and last year, and then there was one group that was followed throughout each year. And I'll show you some of the results momentarily. For 1 year between 1997 and 1998, when this research project funding ended, the community said, you have to keep this project going. And they lobbied the Band Council and health and education centers to provide dollars so that we could continue to do intervention activities. We made a difference right away because we went out putting the message around both about diabetes and the importance of healthy lifestyles to the community, to the children, teachers. We worked with the nutritionists, with the recreation center, and we all got together and worked this message, worked activities and events. And it became immediately popular with the people of the community that they asked it to keep going. So that between 1998 and 2000, with support through private foundations that one of the researchers lobbied for very well, we were able to then go back and continue collecting data from the school children. Cut that out. Okay. In addition, we also then expanded and looked at television viewing, different kinds of foods that were being consumed. And then in 2000-2006, we received 2 grants from the Canadian Institutes for Health Research. One was on community alliances, and the other was on an interdisciplinary health team. And so we expanded the works of the project, and were then able to bring in students to conduct more specific type of work around nutrition and physical activity to make the collection of data richer for us. In 2006, when that funding ended, most of the people left the project, and between then and now, the project was carried by Community Advisory Board. It's still today in existence, economically poor. Like the staff that works there aren't even working full-time anymore, but they continue to go on, and the Community Advisory Board and research team are both expanding their initiatives now, and the intention being that there'll be an application for some more research grants. And I'm harping on the research a little bit, but again, I'm going to come back and do some explanation. And what was your question again?
In regards to the initiatives and which ones were more successful and why.
Okay. Okay. Here, so we'll get to that, yeah. The mission statement of the project, okay, preventing type 2 diabetes through the promotion of healthy eating, physical activity, and positive attitude for present and future generations of Kahnawake, people from Kahnawake, and other Aboriginal communities, achieved by design and implementing school, family, and community intervention activities. This is what the project does. And then as well, it's also conducting community-based research on these activities, training community intervention workers and academic and community researchers, and committed to reporting these results back to the community and back to the larger Aboriginal community and scientific community. So we're responsible for taking what we've learned and sharing that around. Okay? That's him. Yeah, I know, he looks just like me. So the goal of the project, and again, it's repetitive, and I think that's one of the things that was effective in getting the message out. And you say, how do we get the message to people? It's got to be said over and over and over by different people in different ways. Preventing type 2 diabetes among the children and future generations. That's what we're trying to get across. That's the point. And how do we do this? 3 ways. Increasing the physical activity amongst children, improving healthy eating habits, and promoting a positive attitude among children. Okay. What was the background? What was the background behind the project? Well, we were looking at making behavior change, so we were borrowing heavily on cognitive theory, particularly from Banderas. One of the researchers came to the meeting one day and said, Antonio Banderas, learning theory. We all had a good laugh at that one.